the last leg of the conference. I think the slides, there is some, the slides have not come from the preview room to this place. And what? Oh, one more lecture. Okay. Have you got the slides? Yes. See, we use a lot of vitamins and nutraceuticals in our diabetes practice. And the next 10 to 15 minutes, I will just try to go through some of these. It's a very exhaustive topic. I will just try to get through one or two key points and justify whether these vitamins and nutritional supplements are useful for the diabetic patient. This is of importance because if you look at the cost factor, sometimes the cost of these nutraceuticals and vitamins are much more than the cost of the primary therapy. So are we really justified in using this, routinely writing it for our diabetic patients? We'll just go through some of the evidence. See, the term nutraceutical was coined from nutrition and pharmaceuticals in 1985-89 by Stephen DeFacelet, who was a founder and chairman of Foundation of Innovation Medicine. There are other words for this nutraceuticals also. We use the word dietary supplements, functional food, multifunctional food. Another way of broadly classifying is substances which have vitamins. Nutrients are substances which have vitamins, nutritional function, vitamins, minerals, amino acids, etc. And herbal products, dietary supplements. Now we'll just see whether, before that, there are other terminologies used that are micronutrients. Micronutrients are a subset of the larger group of known dietary essential nutrients that are some scientific value. And the quantity which is the daily requirement of this is often less than 100 milligrams. That is why they are termed micronutrients. And they also encompass some of the trace elements which are useful in insulin production and other things. So why we are talking so much about these vitamins and their role in the prevention of complications of diabetes and other things? We'll just briefly touch upon the oxidative stress and diabetes. Oxidative stress is defined as an imbalance between reactive oxygen species production and breakdown by endogenous antioxidants. Oxidative stress has been implicated not only in the causation of diabetes, more important in the complications of diabetes. Some of the vascular complications of diabetes have been implicated by increased vascular stress and increased free radicals that are there in long duration of diabetes. Are there any scientific support for antioxidants? So there are some animal studies. Animals with long lifespan have higher antioxidant levels. And dietary increase in antioxidants increase lifespan in some of these animals. And calorie restriction leads to significantly increased lifespan. All these are animal studies. Whether we can put it to human studies, we'll just see. So how antioxidant vitamins work? I think it's beyond the scope of this lecture to go into the details. Just suffice it to say that vitamin C, E, and A have potent antioxidant properties in a number of biochemical studies and animal studies, which they have a proven data. So the crucial vitamins in diabetes are vitamin A, B1, B2, B3, B6, folic acid, vitamin C, E, D, and pantothenic acid. So basically, from the basic science point of view, there is enough evidence to show that trace elements as well as vitamins have a good antioxidant role. Whether this translates into clinical practice, we'll see from some of the studies. One of the study, I think all of you will remember the HOPE study. We always put the HOPE study for ramipril and prevention of diabetic complications. But please remember, there was one arm in the study where vitamin E was given. If you look into the study, one arm patients were randomized to vitamin E and placebo. Another arm patient were randomized to ramipril and a placebo. Results with vitamin E and ramipril were evaluated separately with placebo. There was a large number, almost 4,761 patients received vitamin E and an equal number placebo. Let us see the results of the study. The primary endpoint of the study was these patients whether they developed myocardial infarction or a vascular event. The trial was stopped for ethical reasons after 4.5 years. The trial was planned for 7 years, but it was stopped earlier for the simple reason there was no significant difference in the primary outcome between vitamin E and placebo group. So vitamin E, which was supplemented for 4.5 years, which has a potent antioxidant property in biochemical studies, clinically it proved it to be a useless agent. So prior to, in the early 80s, most of the patients were supplemented with small doses of vitamin E under the thinking that it can prevent some of the vascular complications of diabetes, but this trial proved that it is not so. There was another trial, much larger trial, the Primary Prevention Project, where vitamin E was compared with aspirin. There were 4,784 patients were recruited. Of them, 1,000 were diabetic patients. In this study also, there was no effect of vitamin E treatment either in diabetic or non-diabetic patients. So another study, another antioxidant vitamin, that is vitamin C, was studied. This study, because of the positive effect of ascorbic acid in reduction of fasting blood glucose in many diabetic patients, there were smaller studies. However, due to insufficient evidence, the safety of ascorbic acid supplementation and due to limited randomized control trials, the long-term use of this vitamin is not advocated. Vitamin D, there is a lot of hype about vitamin E, but at least in vitamin E, there is a lot of evidence that is coming to show that deficiency of vitamin E could be responsible for many of the complications of diabetes. And again here I would like to stress and say, there is no evidence to say whether supplementation with these vitamins can prevent the complications. I think we'll have to wait for much longer time if there are any randomized trials to show that routine vitamin D supplementation is really going to be useful. B group vitamins, with respect to B group vitamins, thiamine, pyridoxine and biotin have been found to be decreased in diabetes. But again, we do not know whether routine supplementation with these vitamins are going to be really useful. Probably the only use of this vitamin B12 which has a scientific evidence in diabetes is in the prolonged use of metformin. Prolonged use of metformin can retard the absorption of vitamin B12, and there could be a vitamin B12 deficiency anemia in patients with long-term metformin therapy. Here it could be used as a supplement. Another aspect of this B2 vitamin is the B12 vitamin, which most of us use for diabetic neuropathy. Though there is still not enough scientific evidence, there is conflicting evidence. There are a number of studies from Japan which have shown that methicobal is useful in peripheral neuropathy, but still all of us have different experience with this drug, and many of us use it probably as a placebo or as an agent for peripheral neuropathy, and many people have found it to be quite useful in some sect of patients. Coming to essential fatty acids, which are also a nutraceutical, particularly omega-3 fatty acid, which is found in fish. Again, there are earlier number of studies which showed that people eating fish, people in northern hemisphere, in Iceland and other places where they consume a lot of fish, they do not get heart attacks. That is because of the increased consumption of fish and omega-3 fatty acid. And the slogan used to be that eat one fish a day and you can prevent heart disease, and all these things were there. But again, omega-3 acid, we know it helps to reduce C-reactive protein and formation of F2 isoprosteinates, both of which are significantly contribute to inflammation and accelerated atherosclerotic process. With this in mind, I think all of you will be familiar with the Origin study, which was with glargine, where pre-diabetic patients with one cardiovascular event were taken up for the study. Again here, one of the arms of the study also contained omega-3 fatty acid. It's a long-term controlled study. And finally, the Origin did not show any benefit. Though we have seen anecdotal studies, smaller studies showing that omega-3 fatty acid is useful, and we have seen that it reduces triglycerides, it may help in other ways, but still it did not show any benefit in the Origin trial to reduce the vascular complications of type 2 diabetes. Then came selenium. Selenium is an important component for the production of insulin, and people thought supplementation with selenium may be useful. There were a number of studies conducted, and the results of these studies have shown diagnosis. This was used to prevent diabetes in patients at high risk of diabetes, and many of the studies showed that diagnosis of diabetes were the selenium supplementation and does not seem to prevent type 2 diabetes, and contrary to that, supplementation increased the risk of diabetes. So selenium as a supplementation was not advocated for the simple reason many of the randomized control trials showed adverse effects in the sense more diabetes were reported in the people treated with the selenium arm. So the nutritional supplements can be broadly classified as those which are beneficial. Chromium we know has some beneficial value. Zinc and magnesium in diabetic wound healing and as well as insulin production it is useful. ALA is said to be useful in diabetic neuropathy. I think there are a number of some evidence-based trials. Methicobal, as I said, there are conflicting reports and it's left to the physician to use it. Vitamin D has I think we have to still wait for randomized controlled trials with vitamin D, though there are a number of studies to show vitamin deficiency in diabetic complications. Perhaps folate is one thing which has an established value, at least in diabetic pregnancy, in diabetic patients planning pregnancy, to prevent congenital malformations in diabetes. Calcium has some value. There are drugs which some partial benefit value. One is omega-3 fatty acid, coenzyme Q. Again, in diabetic patients using statin therapy, coenzyme Q levels have been low. But really whether supplementation with this helps or not, we still do not know. Most important is the last part of it, but not beneficial or sometimes may be harmful. One is selenium, vitamin E, vitamin A, beta carotene. All these have been shown when you use it in excess to be harmful rather than useful. So probably the drugs to remember are the third group of drugs. So finally, with this brief review of the nutraceuticals, is there a role for routine vitamin supplementation in patients with diabetes? That is the topic of the day. So the simple answer is clinical evidence still is not enough. Clinical evidence for use of vitamins as antioxidants is not solid. Though I said experimental studies show benefits, in clinical practice we do not know it is really useful. There are very limited trials and majority focused use on vitamin E and C. There is again a Cochrane review of all the use of many vitamins and nutraceuticals, and again the review has shown that they found no evidence to support antioxidant supplements for primary or secondary prevention. Beta carotene, vitamin E seems to increase mortality, and so may high doses of vitamin A. Antioxidant supplements need to be considered as medicinal products and should undergo sufficient evaluation before marketing. That was a view. Let us look at the ADA nutritional guidelines. We all follow the ADA guidelines for various reasons. And here again, ADA guidelines clearly says that antioxidants in diabetes management, since diabetes may be a state of increased oxidative stress, there has been interest in antioxidant therapy. And looking at the last line, clinical trial data not only indicate the lack of benefit with respect to glycemic control and progression of complication, but also provide evidence of potential harm of vitamin E, carotene, and other antioxidant supplements. In addition, data do not support the use of antioxidant supplements for CV reduction. Again, we still do not have enough evidence, so the guidelines also strongly say that routinely we should not use these supplements. So, the final question, will you routinely prescribe vitamin supplementations in diabetic patients for antioxidant, as an antioxidant effect? The usefulness, I think we'll have to individually assess your patient, whether he needs it or not. The cost factor has to be put in as important because, as I said, most often the cost of these antioxidant capsules vary from somewhere between 5 rupees to 30 rupees a capsule, which is much more than the cost of the primary therapy. And the third is, most important thing is, what if your patients ask for it? Most often this is the situation we come across. Patient, when we finally write the prescription and close the prescription, patients ask for a vitamin or a health tablet or something. In that situation, probably you may be writing an antioxidant or a vitamin. But when you choose a vitamin, please use a harmless vitamin. So, diet balanced with micronutrients should form the essence of diabetes management. I think that is important. We should choose a diet which contains all these essential vitamins rather than going for artificial vitamin supplementation. along with supplementation only when there is a deficiency. Again, that is very difficult to prove there is a deficiency of any of these micronutrients or vitamins. So in conclusion, I would like to say, although medical nutrition therapy is a cornerstone of management of diabetes, several areas of uncertainty in the dietary guidelines still exist. Particularly, the degree of uncertainty is especially high in the area of assessing micronutrient status and the role of micronutrients in the pathogenesis of diabetes and its complications. So laboratory methods available for measuring the status of most micronutrients are still unsatisfactory. See, unlike your cholesterol or other estimation, we do not have standardized laboratory methods to evaluate and say this patient is deficient in this vitamin or this patient has this less of trace elements so that we can supplement. There are still no guidelines, it's only all experimental and research work, and still we do not have any standardized laboratory methods. So with the exceptions of folate for prevention of birth defects, calcium for prevention of bone disease, and probably in the future, vitamin D as a supplement for some of the diabetic complications. Currently, there is no evidence of benefit from vitamin or mineral supplementation in diabetic patients without underlying deficiencies. So routine supplementation with antioxidants such as E, C, and keratin is not advised because lack of evidence of efficacy and concerns related to long-term safety. Thank you.